Hello everyone and welcome back. In this video I'm going to talk to you about a 30-bed mental health facility in Tampa that's just been shut down. And I'll put a link to this article in the description for the video. AHCA is investigating a Tampa mental health care facility after a man died in their care. Records show the staff used the prone restraint. What does that mean? It means they, quote, escorted him to the ground. They face planted him, and then 6 of their staff members held him down to the point where there was so much weight on him that he couldn't breathe, and he died. The state has issued an emergency moratorium blocking Ibis Healthcare from admitting any new patients. Records show a man was admitted to the 30-bed mental health facility back on March the 8th. 11 days later, on March 19th, the man was diagnosed with schizophrenia, and he became agitated while waiting to see his parents. Documents report he was screaming for his mother and threw a plastic hammer. That's when 6 behavioral health technicians moved him into a seclusion room and held him face down as he said, "I can't breathe, I can't breathe." If they're putting weight down on the diaphragm, it makes respiration, the act of breathing in and out, much more difficult. Documents show an Ibis Healthcare tech heard raspy breathing from the man being held down but never reported it to a nurse. Later, the nurse injected the man with medication. After that, he went limp. One tech asked, "What if he is dead?" Another replied, "I don't give a beep." Although techs would check on the man, who was still in the prone position with no response. Documents show it would be 17 minutes before staff started CPR. Less than an hour after the restraint began, he was pronounced dead. State investigators found that the facility's policies do not allow a 6-person takedown restraint, nor did the facility complete an investigation to the client's death. When investigators arrived 3 weeks later, all staff members involved in the incident were still working in the facility. They also failed to report the death to the Department of Children and Families. Could they have been any more uncaring? In 2020, they were cited for the way they restrained a client. So this is not a new thing for this place. Now, I don't know the circumstances of how this individual got there. It doesn't say that he was Baker acted. It does say he had a mental health issue. I thought it was interesting that he'd been there 11 days before they diagnosed him with schizophrenia. Very shameful, very disappointing. But look, I've been very, very vocal about how bad the mental health system here is in Florida. It's draconian. It is broken. And, I have filed at this point close to 900 cases, maybe even more at this point, to get people out of the Baker Act, to get people out of facilities like this. Now, I don't know if this was a Baker Act case as we sit here, but the point is that, obviously, these people just don't care. They simply don't care. And this is not unusual, right, for patients to be restrained, forcibly medicated. We had a woman that was sexually assaulted, had another individual that was physically assaulted. I had another young man who was allowed to leave when he should have been kept in there and then blew his brains out 3 hours later. I just see some horrible stuff. It's not just adults, it's young children, 7, 8, 9, 10. If your loved one has been Baker acted, I would implore you to do whatever it takes to get them out. Okay? That does not mean you go down there and scream bloody murder, because here's what's going to happen. You're going to get arrested. What it does mean is that you reach out to a lawyer and you do what needs to be done to get them out. Whether it's me or somebody else. I hope it'll be me, right? I like to think that we do a great job with these cases, but my point is you got to fight like hell to get your loved one out of these places. You can't leave them there because bad things happen. So I'm interested to hear what your experience has been with these kinds of facilities. If there's an issue going on in your family with regards to substance use, mental illness, and you're sick and tired of being sick and tired, and you want to talk about what options may or may not be available, both legal and non-legal, we'd like to talk to you. Let's see what we can do to help you. If there's an issue that I haven't made a video about, let me know. I'll make you a video, because if it's affecting your family, I'm sure it's affecting somebody else's, and these videos are about giving you information. I know I talk about these kinds of stories, but the idea is, here's a story, and here's how it relates to the work that we do, and how we can help your family. Because these things don't happen in a vacuum. This isn't the first time something like this has happened, right? This is just a prime example, because now the press has gotten a hold of it. Now the light has been shone on this particular facility. So let me know. I'll make you a video. If you like this content, please give me a thumbs up. And if you want more of this content that I make for you every day, please subscribe to the channel. And with that said, thank you for tuning in. I'll see you in the next video. Bye-bye.